My name is Bill. I've been free of cancer for about 14 months now. In September 2010, I was diagnosed with stage 4 squamous cell throat cancer. It had started in the base of my tongue and grew up to the side of my tongue until finally it was obvious and I was biting it. It was in the way. The squamous cell is probably the most common of the oral cancers, but it's not the only one, but it's the most common. And fortunately for me, it doesn't have a high recidivism rate. Once you get rid of it, a lot of time, most of the time, it does not return. There are some others that have tendencies of coming back. I got referred to some good doctors, and the first one I got referred to was Dr. Sandeep Samant, and that is probably why I'm here right now. Actually, for over a year, I would strong tasting foods that I loved, like blue cheese, would make me cough. I'd get a tickle in my throat, it'd make me cough. And that should have been a sign I should have recognized. I thought it was allergies, postnasal drip, something causing irritation in the throat, but I now suspected it was the early form of the cancer deep down at the base of my tongue. And then I had to quit chewing gum. I was biting my tongue. Every time I tried to chew gum, I'd end up biting my tongue. Well, I now know that was because the cancer was causing nerve damage, making my tongue not so agile. It wasn't getting out of the way of the molars, and it was getting bit. Well, I bit myself really good one time, just eating a meal, and it got infected. And I went and got some antibiotics for it, and it didn't really help. So I went back again, got some stronger antibiotics. And it seemed to help that time, but then it seemed to come back. Only this time I realized, wait a minute, that's not where I bit it. Where the sore is now is behind, it's on this side. It was behind my molars. I couldn't have bit there. So that's when I realized I need to go back and see the doctor, and he looked at that sore and said, I have to refer you to someone else. He referred me to an ear, nose, and throat doctor who was very good and also does surgery. But he looked at this, scoped me down my throat and said, I want to refer you to Dr. Sandeep Samant. I've helped him in surgery before, and he is the best man to help you. That was a blessing. At the time I was diagnosed, there was only 3 places that offered that Da Vinci surgery. Memphis, Dr. Samant, he was the 3rd doctor to, authorized to use it. When I first heard about the Da Vinci robotic surgery that he was offering, to me, that was just a godsend. Because when you hear about what the alternative is, you say, thank God for putting me here at this time. If I have to have this disease, this is the way I want it cared for. The traditional way of treating cancers on the tongue and deep in the throat, they split your face open. Just cut your jaw right in half and splay you open so they can get down inside. In December of 2010, I had the Da Vinci robotic surgery that Dr. Samant did on my throat, and they also went on the sides to take out the 48 lymph glands, 2 of which they still found were active cancer, but they were isolated, and that was followed then in the spring by 6 weeks of radiation. Much less invasive, and your recovery time is sped up tremendously. It may not be why I'm here right now, but it's why I'm here and am able to talk and eat and not feel totally disfigured with, having, my face totally scarred up from that very invasive surgery. I am very lucky. If I'd have been back in Washington State, I'd have had the old kind of surgery. The robot surgery that Dr. Samant uses saved me from having to have my face split open. And then, the length of time you have to recover just from that, I was saved from all that. And when I went to have the radiation, they worked to keep my dosage down to 60,000 rads so that I could actually keep my teeth. A lot of times they have to remove your teeth when they radiate your head and neck. I have to do fluoride treatments twice a day, and floss and water pick and all that, but it's worth having my teeth, and it was well worth it not having my face split open so they could get down my throat to get to the cancer. Well, they were able to do it without traching me. And for a guy who likes to eat and talk, that meant a lot. He put, without sacrificing what needed to be done, he took into consideration what I liked about life. And you can't ask for anything more than that in a physician, in a surgeon. And as busy as he is, and as many patients as he has to have, when he is sitting in that room with you, you feel like you're the only one that matters to him at that moment. And I tell you something else that's very important to me. You can get a good idea on just how good of a surgeon he is by the quality of people that surround him. Good people want to work for him and learn from him. And he has got some good people around him, and that's critical. I think most people are pretty amazed at the recovery that I've had, but I've had some good treatment, and I'm happy to be here. I wasn't a smoker. I smoked a pipe probably about 12 years ago, 14 years ago, for about 2 years. And I generally smoked maybe 3 times a week. I liked a pipe tobacco after a big meal. Found it relaxing. I enjoyed the aroma. But I was not like a constant cigarette smoker. Have never abused alcohol. I've had a few drinks with like a glass of wine with a meal or something, but not one to abuse alcohol. And so people were amazed, surprised that I would get, because that's the first thing people think of: smoking and drinking, oral cancers. I think part of mine was caused from, and this I think is only contributory, it's not the total reason, but it is contributory. I had acid reflux, and I hadn't been managing it well. And I think that constant irritation deep in the base of the tongue and the top of the esophagus, I think that added to my cancer, or helped get it started, helped the cancer find a toehold. The other contributory, and no one wants to talk about this, is the HPV virus that is known to cause cervical cancers. Well, if you engage in oral sex, it can cause oral cancers, not just cervical cancer, but then you're going to get oral cancers from that too. In my case, I asked them specifically, once I found this out, do you see any evidence of HPV? You know, and they looked and they couldn't find it. They can't rule it out because some people, just as with genital HPV, sometimes you can have those little warts and they can be not detected. They can be so small that they're just not readily noticeable. So in my case, they can't say, yeah, that was a contributory factor in you getting oral cancer. But I also know that they didn't entirely rule it out. And I think that it's something people have to be aware of, that oral sex is not entirely safe, that it can spread oral cancers. After you get your treatment for oral cancer and the surgery and the radiation, your throat muscles are, they get weak. And so you have to get therapy, a lot of swallow exercises. Some of those exercises, some of those sounds that I have to say repetitively that get mind-numbingly, with mind-numbing repetition, and you just get sick of it. And then also that tonal quality of the ahs. So I thought, well, if I write a song, I can do both at the same time and maybe save me some time. So I wrote this song with a lot of hard G and the K sounds. And one of the exercises is ka-ka, ka-ka, ka-ka. So I thought, well, wait, is there a word that has that ka-ka? And the word cacophony came in mind, meaning noise, meaningless, bothersome noise, a cacophony. So this, the name of the song is Cacophony. Cacophony, cacophony, cacophony. My neighbors think I make a great cacophony. At 6:06 a.m. they called the cops on me. For vocal exercise they threw the book at me. Cacophony, cacophony, cacophony. My neighbors think I make a great cacophony. At 6:06 a.m. they called the cops on me. For vocal exercise they threw the book at me. I remember the first time, it was early September, I had the first steak that I'd had in like a year. It was a big, thick filet mignon, and it was great. It probably took me 2 hours to eat it all, but I ate it and I enjoyed every bite. I've been treated so well, and the care that I've received is responsible for me appearing to be healthy, and because I am healthy. I've had the 3 pet scans and a couple of cat scans, and I mean they're doing head-to-toe scans. They're looking for cancer anywhere in my body, and I am cancer-free now since December of 10. If I'd have been any place else, I wouldn't have been able to get that kind of care, and I would still be recuperating from not just the cancer, but the treatment of it. I just can't think that you're going to find better care anywhere in the world, certainly in the country. I don't know where else in the world you're going to find better cancer care.